Hi, this is Dr. Whiting again, and I'd like to talk to you today about a man's issue. In fact, it's the #1 reason why men over 50 visit their physician. It's because of prostate problems. Now, the most common prostate problem is what we call BPH, and that is a inflammation or a swelling of the prostate gland to the point when this enlargement can cause a variety of health problems. The most obvious thing is a restriction or a reduction of the flow of urine from the bladder. This causes the man to have to repeatedly evacuate, go to the restroom, get up 4 or 5, 6 times at night in an attempt to empty the bladder and so forth, because the pressure from the prostate is now reducing urine flow significantly. One of the main causes for BPH or enlarged prostate is a hormone called dihydrotestosterone. And dihydrotestosterone is formed from another hormone, the primary androgen or male hormone, called testosterone. And this conversion of testosterone to dihydrotestosterone occurs in greater percentages or in greater amounts as we grow older. Early signs of excess dihydrotestosterone in the body include a loss of body hair, or rather lots of body hair, heavy body hair, and loss of hair on the head. So you see these guys that have a receding hairline, they have very thin hair on the top, and yet they have a fairly high amount of body hair. This is generated primarily by the excess production of the hormone dihydrotestosterone. Those individuals tend to have or tend to be more susceptible to prostate problems such as BPH later in life. So if that describes your physical makeup, you guys might want to think about doing some preventive measures before you start to develop a prostate problem. And we'll talk about those in just a second. Now, as the body converts this dihydrotestosterone, it causes all sorts of various other potential complications. It has even recently been linked to weight gain in men. However, there is some good news. In order to prevent the production of dihydrotestosterone, which is not only related to the hair issue, but also is the primary reason why the prostate enlarges, because it's literally becoming overstimulated and the cell growth accelerates. Many people think that BPH might be a form of precancer. There is no overwhelming evidence to show that this is true. However, men with BPH tend to develop cancer later in life a bit more frequently than those who don't have the problem. That does not mean that if you don't have BPH, you won't get cancer. They're not that linked. So we need to always take the precautionary measures, get your prostate exams regularly, especially after age 50 or 55. But BPH is a precursor to much more serious problems in the genitourinary tract, because if the urine flow is sufficiently reduced or cut off, that sets you up for repeated bladder infections, that sets you up for kidney infections. There's a whole host of domino things that can take place. Fortunately, there are a lot of key nutrients that are very helpful in reducing the production and controlling the production of dihydrotestosterone. See, we want testosterone. We don't want dihydrotestosterone. Some of the nutrients that we use are pumpkin seed extract, saw palmetto, Pygeum africanum, and a host of amino acids such as glycine, alanine, glutamic acid. We use stinging nettle extract, which is an herbal extract, and it has a natural anti-inflammatory property to it, which is very, very helpful. And then, of course, we use essential fatty acids because the omega-3s and specifically 9s are extremely helpful in prostate health because they reduce the production of dihydrotestosterone. What we have done at our research center is we have combined all of these nutrients, amino acids, some vitamins, and a lot of these herbal extracts into one convenient-to-take formula. And that formula we use at our research centers, and it's called Prostate. And Prostate is available from a company in Southern California called Phoenix Nutritionals. And Phoenix Nutritionals may be reached at their toll-free number at 1-800-440-2390. or you can access them on their website at www.phoenixnutritionals.com. I'm Dr. Whiting, Director of the Institute of Nutritional Science, an independent organization dedicated to nutritional research in prevention and alternative medicine of many common chronic degenerative diseases. If you have questions or are in need of extra information about alternatives available for your health conditions, you can reach my office at Ask the Doc, ASKTHEDOC, at healthyinformation.com. You can also reach my office toll-free at 888-454-8464. Prostate problems need not be a given. Prostate problems need not be an ultimate fate for every middle-aged and elderly man. But if you have the type of body chemistry that is producing excess dihydrotestosterone, it's time to do something sooner rather than later. Our unique formulation has helped thousands and thousands of men to prevent and even reverse symptoms of enlarged prostate. It can work for you too. Thanks for listening.